I'm Spencer King. We're here to talk about women in interventional cardiology, and I have with me 4 women who are very interested in this subject and I think can help us understand some of the problems. Mirvat Alasang, who from Jeddah, Saudi Arabia, Alexandra Lansky from Yale, Dawn Abbott from Rhode Island, and Cindy Grines from Atlanta, Georgia. And we've got a problem. We don't have enough women in interventional cardiology, and we need them. We need them desperately. So let me turn to you, Cindy, and ask you, why don't we have more women in interventional cardiology?
I think it's multifaceted, Spencer. It's not just one thing, but what I think is the biggest issue is pipeline getting into intervention. So for example, if you go into medical school, you never once take a rotation in interventional cardiology. Furthermore, it's not mandatory to take a rotation even in cardiology, even though it's the #1 killer of patients, and yet there's not a mandatory rotation. It's kind of crazy. And so I don't think there's exposure at young ages to interest those students to apply to interventional, prior to that cardiology and prior to that internal medicine. We need to try to streamline the process, shorten the time that it takes to become an interventional cardiologist and expose those medical students at a much younger age.
Speaking of expose, I'm going to raise this issue. Dawn, you've been doing this a long time. You look pretty healthy to me.
Yeah.
You've been in the cath lab a long time.
Yeah.
What about this whole thing that women are scared of radiation?
Yeah, I think there are several aspects of the interventional lifestyle that women are concerned about. One is radiation, specifically during the time of pregnancy, and there's clear evidence that can be done safely, wearing the appropriate shielding and fetal badges to monitor. So I don't think that should be a deterrent, but it's out there, and women are concerned about it. And I think just presenting the data and making people aware that it's not a barrier is important. I think, secondly, the orthopedic issues everyone faces, men and women, and people need to keep physically fit and strong during their training and throughout their career to combat some of those concerns, because they are real. I think just in terms of childbearing years, we do our internal medicine residency, cardiology, and interventional training during the ages of 25 to 35, when most women are considering having children. And it's not just the pregnancy aspect, but also the child care aspect, that women are often carrying most of the burden of child care and housework, despite the fact that this isn't something that specifically women need to do. So I think having a social support system, having partners who are aware of the requirements and the dedication it takes to be an interventional cardiologist would really help women.
Yeah, I mean, I'm reminded of when I went into training and I had a partner who did everything and I didn't do anything, and that seemed normal in those days.
Yeah.
But it's probably helpful for women too.
Yeah.
Alexandra, you've talked to me in the past about mentors and the lack of men. I mean, how important it is that a internal medicine resident, a little bit interested in cardiology, gets into cardiology, and how important it is that they see some other women in their field and maybe have within their own institution women. How important is a mentor?
Yeah, I think the whole mentorship thing is absolutely critical. I think it's equally critical for men as women, but particularly for women. They're facing isolation, they face discrimination. I mean, there are many, many issues as we've all gone through our careers. And I think, teaming up with somebody who may have lived through that, you can advise the younger people coming through as to how best to navigate it. Maybe not, confront, maybe try and avoid conflict, maybe see it from a bigger perspective. Keep an eye on the goals, what's important. Keep an eye on your clinical practice, the patients, your science, etc. And I think, mentors are absolutely, needed in that respect. And the other thing is, I think, as you go through your career, it may not be just one mentor, but you're going to probably change mentors along the way. You may want multiple mentors to, address different issues. But, I think it's absolutely needed and necessary.
You've all been pioneers, but Mirvat, you've been a special pioneer because you were the first female interventional cardiologist in Saudi Arabia, I think, in Jeddah. Trained in Detroit, went back, and so how successful have you been in mentoring and getting other women to engage in this field?
Well, I think just to kind of follow on what others have said here is that you need a role model, and you need to see women in their lead, in the cath lab, operating, doing procedures. They need to see them at the podium. And naturally, when I went back, my first few years, I wasn't necessarily doing that and showcasing it. I was still trying to establish myself in my own institution amongst my colleagues who were already giants at the time, and just kind of having the administration warm up to me, understand that they can trust me, and eventually become a cath lab director. At that point, I think it became easier for me to become a role model. And I was at the podium, and I was speaking at conferences, and young women were tagging along and shadowing me, career shadowing me, and coming into the cath lab and seeing a woman operate, make the calls, run the codes in the cath lab, and understand that this is not only a man's domain and that a woman can do it very well. And over the course of 8 years, we've seen women in the region of the Gulf all come back, some from UK, some from the United States, some from Canada. There are approximately 5 to 6 right now who have come back in the last 2 years. And so it's progress to some point, and that I'm proud of.
So within the whole world, especially in the United States, I'm understanding that there's some organization to this idea. Women in cardiology are beginning to look at this together. I mean, what kind of group activity or politicking or whatever, does this all have to be done just by one woman going and saying, okay, I'm here and I'm going to do it, or do you band together for some common goal?
Well, we have, as part of SCAI, we have our SCAI WIN, Women in Innovations. The ACC has their own WIC organization. Roxana Moran started up a Women organization. And so I think at the national and international level, those exist. And at this meeting, Ron Waxman has been incredibly supportive at putting on several symposia just for the female interventionalists. But as part of that, we try to get down into the weeds a little bit and find out what the specific issues are and give advice to those individuals. So it's nice because we have those organizations. It's nice because the organizations are trying to promote women to be speakers and be seen at a national level. And we're trying to have some interaction one-on-one.
Let me go back to my first assumption that we need women in interventional cardiology. My wife has a woman internist. She's comfortable with that.
Yep.
I think that makes sense for her. Interventional cardiology is so far down the line. It's a very, cath, men, women, everything. I'll come to Saudi Arabia a little later, but but in the United States, what's your feel now for women and interact? Because interventional cardiologists in America aren't just in the cath lab. You're in the clinics, you're seeing the patients, and many times long-term follow-up, right? So,
of course.
So what's your view of, Dawn, are women sort of attracted to you because you speak their language?
I think there are some women who specifically seek out female physicians and they feel more comfortable, but I think it goes way beyond the individual patient. I mean, there are studies that show that if a woman is having a heart attack and they're treated by a female cardiologist, that their mortality may be lower, and that also men that practice with a woman in their practice, another partner who's female, that they will take better care of women patients. So it's just recognizing that the manifestations of the disease are different in men and women, and women tend to advocate for research about women. And men necessarily, they may not want to focus on it. It's not that they are not interested, but I think there are a lot of women investigators, a lot of female cardiologists who focus on studying specific cardiovascular diseases that affect women. Spontaneous coronary artery dissection, the postpartum conditions, the atypical nature of angina with microvascular disease. A lot of these conditions have been highlighted because of women in the field that are really interested in understanding how to treat our patients better. So I think it just makes us a stronger community to have men and women working together, to have a broader perspective, to look at cardiovascular patients in a different way. I think just getting back to what Alexandra said about the isolation, most of us were the first. You know, I was the first interventional cardiology fellow to be female at Yale, or Cindy Sure was the first. And about 40% of women that are practicing in the United States are the sole woman in their practice. So it's a day in, day out, thing that you're the only one. So even though at meetings it's terrific that we group together, that we do have resources and see each other, I think until we make a bigger dent in the deficit of women, that it's still going to be hard for people.
I know that our viewers are curious about Saudi Arabia and the Gulf countries, and so as a woman taking care of patients in Saudi Arabia, you're taking care of women exclusively, or how does this work?
No, I take care of both men and women. Yeah. And I think when I started, ironically, what worked against me was not being, it wasn't the gender, but what was working against me was actually being young. When you go in and you're consenting your patient and their family, it's a very conservative environment, and you don't consent the patient alone. You always consent them with their family. So you walk in and you find a patient with 4 or 5 other family members, and you walk in, you're small, you're petite physically, and you're also young. That really works against you. They just somehow expect an older person.
I would love to, being on the other end of the spectrum, I would like for it to work for me as well. But I understand completely what you say. People kind of want authority figures, and you have to convince them that you are indeed that.
Yes.
Well, are there any other questions you'd like to ask each other?
Well, I'd like to point out that I think the attrition out of interventional cardiology is higher for women than for men. And I think that once you really enjoy patients, you have a passion for doing procedures, but once you get into your job, it's just too difficult to maintain that. And I think that we need to look at avenues to give women, a different schedule perhaps, not necessarily shorten the hours, but, let her start after she drives the kids to daycare, instead of expecting her to be at work right before daycare even opens. Or things like, what do you do when the children have a school day? And, perhaps these hospitals could have daycare for those situations. Or even shift work. We talked a little bit in the past about shift work for women or job sharing. And right now that doesn't exist.
So it occurs to me that a great deal of the things we're talking about, women are disadvantaged with in our current situation, and I'm interested in the national conversation about equal opportunities for women. A lot of it is not for doctors to figure out, it's for the country to figure out, how are we going to enable talented women to do this. It occurs to me that over half our graduates now are women from medical school, and in cardiology we're behind the curve, and interventional cardiology we're way behind the curve. And I appreciate all of you visiting and sharing this with us today, and finding solutions for this pressing problem. Thank you so much.
Thank you.
Thank you.